We will be implementing a nice public health guideline and going completely smoke-free. We wanted to make sure that you understand why we are taking this journey together so that we can all be confident in getting to the destination. Smoking is the single biggest health problem in the UK and will kill 1 in 4 smokers between the ages of 30 and 69. This means that the choices we make today could help our service users live longer and healthier lives. As healthcare professionals, our service users already look to us for their healthcare advice. We don't give them alcohol, so why is smoking any different?
Okay, stop. I agree with you, but I don't know if I can actually do it. What about Bob, one of our inpatients? He looks forward to his smoking breaks. Isn't it cruel to take away that pleasure?
This is how Bob feels every day. He's not been smoking all night, so he wakes up really wanting a cigarette. His nicotine level is low. He's probably not feeling too happy at all right now. So this is during the morning cigarette break. Now his nicotine levels are replenished. He's feeling back to normal. But as the morning goes on, his nicotine levels dip and he's feeling bad again. But this time, no one is there to escort him. So he keeps waiting and waiting, feeling worse and worse, until someone is finally free to take him outside. Isn't that a bit cruel, to let Bob continue the cycle of craving and addiction?
Well, I guess so, yes. I never thought of it like that before.
What if you could help Bob to manage his addiction so that he never felt like that? It's the withdrawal from nicotine that makes him feel so bad. So what if he had enough nicotine in his body to stop that from happening? Smoking doesn't actually relieve his stress or calm him down. The nicotine only relieves the withdrawal symptoms caused by not smoking. We can use nicotine products to help manage those ups and downs so that Bob doesn't have to worry about when his next cigarette break might be.
Okay, but what do I do if he gets aggressive when we can't go out for a smoke break?
The same thing you do when anyone gets aggressive. You have the skills and experience to de-escalate those challenging situations. Smoker or non-smoker, it doesn't make a difference.
No, I suppose it doesn't.
We will be training staff on the wards as smoke-free champions so that you can also provide specialist support to Bob should he or you want that extra helping hand.
It's good to know the staff are all in it together and can support each other.
So in exactly the same way we no longer smoke in pubs or restaurants, it will also just become accepted, and then Bob won't think twice about it.
That's true. I completely forget it used to be so normal to have a smoking and non-smoking section when we went out to eat, and now it's just not.
Right, and you can still take him outside for a break and a chat. Smoking ticks many boxes, and sometimes it's not always about the nicotine. You might like to ask Bob what he would like to do during those times instead. I want you to meet Kate, Harriet and Alan, who are mental health inpatients just like Bob, and who've all gone smoke-free.
I used to smoke 50 a day and not one puff in a fag for 6 months. Just think what else I can achieve.
I feel so rich these days, the richest I've ever been.
For the first time in my life, I feel I can do anything.
Anything? That's really quite empowering, isn't it? Just one small thing. I smoke too.
You and Bob can help each other. And don't forget you are 4 times more likely to quit successfully using an NHS service. There's loads of information about finding your local NHS service on our smoke-free section on the intranet, along with information about medication and which products might suit you best. Have a look next time you're on there.
Okay, well I feel more confident now. For Bob and for me, I'm ready to give it a try.
That's all we ask. And there might be bumps along the way and lessons to learn, but that's what reaching for excellence is all about. So look out for your teammates. Make sure you talk to your manager. Let's show how to make it happen.